This video will show you how to make a posterior elbow immobilization orthosis, also known as a long arm orthosis.
In our case study, our client fractured her right distal humerus 1 week ago after she fell off her bike. She presents with considerable swelling and pain in her elbow and proximal forearm. Her physician has ordered a custom orthosis to protect the fracture.
The material used should be 1/12 inch thick, have a low resistance to stretch and high conformability to conform well over bony prominences. Memory is needed if edema is present or frequent adjustments may need to be made. Coating should be included as it will be pinched during the molding process, and this allows the orthosis to be pulled apart once it hardens.
With a tape measure, measure the width of the hand from the MCP head of the middle finger on one side of the hand to the same point on the other side. Measure the width of the mid-forearm. Measure the width of the elbow from the lateral to the medial epicondyle on the posterior side. Measure the width of the widest part of the proximal arm. Then measure the length of the entire arm from the distal palmar crease to 2 inches distal from the axilla.
Mark each measurement on a paper towel. Connect the measurements around the entire pattern. It should look like a trapezoid. You can add dotted lines to outline where the elbow should be positioned on the pattern, but this is not required. Cut out the pattern, but leave the dotted lines intact.
The distal palmar crease should be cleared. The pattern should be able to be pinched at the proximal arm, elbow, and palm.
Trace the pattern onto the preferred thermoplastic material.
After activation, cut the pattern on the inside of the line.
Position the elbow in 90 degrees of flexion. The forearm should be in neutral and the wrist in 0 to 20 degrees of extension. This position keeps the elbow in a closed, packed position, can help with reduction of edema, and is more comfortable for the client. This position also helps prevent stiffness and shortening of structures. During molding, use the stretch and pinch method. Stretch the material circumferentially around the entire arm, pinch the warm material together at the proximal upper arm, elbow, proximal forearm, and palm. When cooled and hardened, pull open the pinches and trim excess material. You can position the client in standing as shown, or the client may be positioned in supine with the shoulder flexed at 90, elbow flexed at 90, and the forearm and wrist in neutral. This position allows gravity to assist with molding for optimal conformability.
Trim away the excess material, round any sharp corners, and flare out any edges as needed.
One strap should be positioned from the palm to the dorsal aspect of the hand. It will cross the thumb web space. A second strap is positioned at the proximal forearm. 2 straps can be crossed at the anterior cubital fossa to secure the elbow in the orthosis. Place the last strap at the proximal arm. So now that we just showed you how to put the orthosis on with all the straps, we'll go over when to wear it. You'll be wearing the orthosis for 4 to 6 weeks depending on how the healing process is going, so all day and all night, but you can remove it to clean your arm, to clean the orthosis, or to change any wrappings under there. You can clean it with a Clorox wipe, or you can throw it into the washing machine on a cold, delicate cycle, but don't put it in the dryer because it'll melt the material. Okay, do you have any questions?
Yeah, so since I have a lot of swelling right now, what do I do when the swelling goes down and the orthosis doesn't fit that well anymore?
So as you continue to heal and your swelling goes down, we'll keep remolding the orthosis to make sure it still fits your arm.
Okay, that sounds good.